think at this point, the pandemic has really slowed down, really to the point where I haven't even really had a patient with COVID for the past several weeks. If you come into the emergency department and you want COVID testing, we will test you for COVID. And if you are in the emergency department and need to be admitted to the hospital for emergency surgery, we will offer you almost same minute COVID testing, right, to clear you to be able to get your surgery. So yes. The facilities that we have at all three campuses, Foothill, Intercommunity, and Queen of the Valley, are ready to service them. You know, we're offering the same high level of service that we did prior to the pandemic, and we'll offer, if anything, even better service now. I think that my job has definitely gotten much more difficult from the point that patients do delay their care coming in, and so by the time that I see them, they tend to be a lot sicker. And that's hard for me, because it's very sad for me when I see a patient that if they had come a day in earlier or maybe a week sooner would have had a better outcome. And instead, you know, I have patients that have had appendicitis for a week and decided not to come in because of fear for COVID or for whatever reason they decide to delay their care. Or patients that decide to wait to see if they get better with their chest pain, like they have high-risk symptoms. They can't move half their body. Oh, I'll wake up in the morning and see how I am. Let me just go to bed and see how I am in the morning. You can do that, I suppose, but the problem is what if it's a stroke? What if you're having a stroke and you're waiting? Every minute that goes by, you lose 3 million brain cells. Are you really gonna risk getting permanent disability or having to have your family take care of you because you decided not to come in sooner? And I would venture to say if they knew they were having a stroke and they knew what would happen, they wouldn't do it. Or if it's gonna worsen. That's the other thing. Sometimes your symptoms start off, and this is what I see all the time in the emergency department. People think that their symptoms, whatever they may be, are it. Oftentimes it's just the tip of the iceberg. You shouldn't ignore your symptoms. Your body is always in perfect balance with the universe, right? It is. You know when your body's healthy. You know when something's off. And it's best just to come in and get checked out. Sometimes it's better just to be safer that way. So, and we don't see that as much with COVID, right? We see people waiting until their symptoms are really severe. And the longer you wait, the sicker you are, the more difficult it is to make you better. Where if we can diagnose even something bad early on, we can give you medications and prevent it from getting worse. So. In the past year, we were able to take anyone that walked in the door with a stroke, and we had the service to provide a thrombectomy and remove a blood clot from the circulation in someone's head. And that's state of the art right there. That's state of the art. Already we had it. But we actually have gotten our certification now, and we'll take ambulance runs. So anyone that has a large vessel occlusion or a very large stroke will be brought to Queen of the Valley, and we can offer them state-of-the-art comprehensive stroke services there. At Intercommunity Hospital with our STEMI Receiving Center, which is a massive heart attack, is we have specialists on call 24 hours a day to take anyone that's having a massive heart attack and open up the blood vessel in their heart to allow their heart to have blood to flow back into it. And, you know, that is, it's life-saving. The longer you wait with your heart attack, the more chance you have of either one, dying from the heart attack, or two, being permanently disabled and not being able to do things like go grocery shopping because you're too short of breath for the rest of your life, right? I mean, it's basic things like that. That's why heart attacks are devastating for people, right? Even if you do survive it. So, but the earlier you come in, the greater chance you have of surviving it. I just like talking to people, all sorts of people, and getting to know what was going on with them and helping them out. I've been doing it for 10 years, And I'm just blessed and happy that people allow me to take care of them, and that they have that level of trust to let me be the one that makes and helps them through difficult times. So, and that's what I do. I go home and I study. I continue to learn and try to give people the best, most up-to-date care that I can. The reality is at the emergency department, a lot of people come maybe not saying what they're really concerned about, but the majority of people use the ER to make sure they're not having a heart attack, they're not having a stroke, they're not having a severe infection. We diagnose people, we give them all the best medications we can, and we help them. We're here for you. Don't delay your care.